They're getting around that now. Why they're not even using people with rescue license. They're just placing the wasp riders on them.
Yeah.
Waiting till they go through KHS, get their spay, get their vaccinations, and then picking them up for pennies on the dollar. I mean,
but then they're charging $250 when they only paid $75 to adopt the dog out of KHS.
Do all the vaccinations
and that ain't. I don't feel like that's the way
we've had a lot
rescue
of
should be.
that just in the past month.
Yeah, guys, I should keep my integrity intact, as little of it that I have left remaining. You know, you will find these things happen. It will happen again. Okay, let's just real quick, the whole Bowie situation, dog in the trash can. Okay, yeah, crappy situation. Nobody likes that. I tend to be devil's advocate. And again, it's because I've seen too much. Where am I mad at the people who put them in the trash? Yes. Chances are, and I'm saying this with love, and again, experience, guys, it's not just bias. Chances are they were not English speaking. They were not members of the community. They did not have access to resources. They had no idea who to ask for help. Okay? I can take a little blame off of them because they didn't have all of those things. Is it wrong that they put them in the trash can? Yes, of course. Of course. But I am not like one of those people, I'm gonna murder you. I'm gonna find you. You deserve to be tarred, intestines ripped out. You deserve to die.
Have you seen the?
Oh, I read the Facebook comments.
Have you seen the thing on it?
And I tend to say, let's not threaten jail. Let's say, hey, can we help you? Can we help you? Maybe you have other pets at home. Like, I'm not the one that jumps to, you know, let's cut this guy's head off because he put a dog in the dumpster. Let's help him improve his life and hopefully any other pets' lives, right? And the rescues that took that case, they were very, very vocal about their feelings. And I don't like that. I don't like that. I don't think that that's good human qualities.
Have you seen the?
Yes, it was a bad case.
Have you seen the documentary on Netflix? It's like Don't F with Cats.
Yes.
Oh, God.
And they like, yeah,
that's a good one.
and they
That
like,
was
pushed that guy.
So I don't disagree that there was some. He was feeling like he had to now.
But that's the same thing with the rescue. Is they put too much. It was one little thing, and it's like you put so much emphasis on it that it became this big escalated.
I mean, I think Wichita, and this again goes back to a lot of my shelter experience, that so many of the people in our population, they have no idea about the resources available to them. And, you know, when we take in, you know, I don't know how to say this nicely, guys. Please understand, I'm trying to really be nice about this. But when they maybe come into our community and they, again, don't have resources, and if language is a barrier, that's even harder to ask for help. And to just ask a simple question like, my dog is starving, you know, what can I do? I mean, I feel like there's so many different things that come into play that you can't just be that, you know, I'm off with their head type of person. Let's help, let's educate, let's make the resources widely known to folks to maybe stop that from happening again, right? Also, the reason why I can't throw away my Sindauer in the trash can. And I need to, she's moldy. But if I were to throw my fake dead dog away, probably have some issues.
They even have a program where if you bring in a litter of puppies, we will spay them off for free.
Yeah, yeah. And again, how many people don't know that though? Yeah, absolutely. And I never try to fault the shelter as much as I can because they do the best job they can. Now WASP also, I try not to fault them. They're doing the best they can with what tools they're given. It's the rescues that manipulate and exploit this. Otherwise, I think we would have a pretty damn good handle on overpopulation in Wichita if it were not for the rescues. And you can take that to think. I have a couple pictures for you. Just wanted to show you a couple things. We don't have to hit the lights. I think it's pretty obvious. This one is pretty dang obvious. So lungs are the black triangles, right? The black tube is supposed to be the trachea. See how it, not even, like what? How? Who? How? And yeah, ouch, right? You can kind of see a little bit of this one too. So you can see that it really closes off there. And this is a lot higher up than what we're rubbing, right? But the entire trachea is made of those C-shaped muscular. So I think even when we're rubbing up here, it helps to just soothe and relax the rest. But that's, I mean, really obvious.
Does the swallowing motion kind of help it?
I think so. I think so. Yeah, you know, there is lots of schools of thought on this. So this one, I don't know if you guys can see, but this is actually a surgical repair where they put in a little stent. Yeah, so this is a K-State surgery, guys. There's no vet in Wichita doing this. Okay, this is like $5,000. I would venture that. But a surgery can fix really, really severe collapsed tracheas where, again, you know, if they can't breathe, you got two options: fix it or go to Jesus, right? And then I thought I'd just show you too, just because I always think that it's kind of cute, even though it's not. Yeah. So cats, unfortunately, suffer from asthma a lot. And this is something, if you smoke in your house, right, cat's gonna get asthma. We really shouldn't even be using, and I'm guilty of this myself, guys. I love my wax warmers. I love my little wax warmers. But those scents, that big scent that makes my whole house smell beautiful, can be a respiratory irritant to our cats. Okay, if you think of a cat as kind of like a baby, right? You wouldn't smoke around a baby. You wouldn't put a baby right next to like a scented candle. These are the same kind of things that we try to think of with cats. And it's unfortunate when you do have to get to the point of actually treating them. But I will tell you what, because I've had a couple of these patients that were doing the inhaler in hospital, they know that it's helping them. Because usually you think a cat is like gonna the whole thing. They know that it's helping them. So they do often allow you to perform the treatment pretty easy.
How do you know they happen?
So they're coughing and wheezing. Like you can hear them wheezing, just like the person. Yeah. What were you gonna say? Same thing? Did you have something else?
Yeah, my boy uses the arrow cat.
Oh no.
He's got really bad asthma.
How old is he?
Now he's 8.
Yeah.
But when he was a kid, it was really bad.
Aw.
Because he pants like a dog.
Mhm.
And that was like the first sign.
Yeah.
Catch his breath while we were playing.
Yeah, cat panting, never good. And yeah, it is. It's relatively common. Yeah, kind of sucks. Yeah, Rose.
So what would the difference be between the asthma or allergy and respiratory infection?
You mean to cause this?
No, to like tell the difference.
Oh gosh. Okay, so upper respiratory infections in general, you have lots of nasal and ocular discharge. So crusty nose, crusty eyes, maybe some open mouth breathing. Again, kind of like how we mouth breathe when we're sick, same kind of thing. Allergies often similar, but they're not as long lasting. Often they come and go, they fluctuate a little bit. Where a URI, you have it, I mean, for a week, for 2 weeks, for however long. And then with asthma, like I said, symptoms are usually coughing. They have this kind of like retching, and it's almost like you're gonna throw up, but you never throw anything up, and it's just, again, trying to clear that airway. But yeah, coughing is a big one. I would say maybe open mouth panting, but I wouldn't classify that as an entirely unique symptom. But then also wheezing. I mean, you can hear them wheezing. And when we do our physical exams and you guys are sculpting the heart, you also will want to listen to the lung fields as well on all of your patients. And generally, what I kind of tell my students when listening to the lungs, you shouldn't hear anything. Really, you don't really hear anything. You might hear it in, out, kind of whoosh back and forth, but generally you don't hear much, and that's a good thing. It's when you hear crackles or wheezes or squeaks even, that we can say something else is maybe going on. Yeah, good question, because it's kind of across the board, but URI is caked with crap. Like they need to blow their nose bad. Yes.
So like no candles at all are good?
No scents really is the rule. Now, do I 100% follow this? No, I don't. But yeah, they say Febreze, anything with any type of phenol, and a lot of our candles have phenols. The wax warmers.
Essential oil.
The essential oil diffusers, all of that kind of stuff can be a respiratory irritant. Now I'll say, guys, like I'll sometimes put in wax warmers like upstairs and downstairs, and I'll like run outside and get the mail, and then when I come back in, I'm like, oh, I can't even breathe, it's so strong. But eventually, you know, I get used to it, and my house smells good. But I do think, you know, if the cat was right by it, you know, if he was affected too. Yeah.
Is there like a rule, like a certain amount per like square foot is?
I don't know that. I think the safest bet is just to not.
Yeah.
It's just to not.
Bear in mind,
Phenols, PHENOLS.
bear in mind, anything that will irritate your cat will kill your bird.
Yes. We'll talk all about that. Okay, so just a couple more slides to go here, guys. So we're all done here. So when we're talking about things like asthma, and this is the same in cats as it is in humans, but it is constriction of the airway. So with doing the inhaler or breathing treatments or what have you, what you're trying to do is open up the airway. You're opening up the big tubes, the little tubes, and the little sacs. And that's the whole idea with asthma treatment, is to open up the airway so they can continue to breathe. All right, so the bronchial tree, the big main branch of the bronchi, has some muscles and has some nervous system innervation. And this is related to our fight and flight, just the same as the heart was. So when we talk about fight or flight, what happens with the heart is it gets faster. What happens with the lungs, or specifically the bronchioles, is they open up, they dilate. And the idea for that is, again, if I'm fighting off a bear or running from the bear, my heart is fastly pumping, and my chest has opened up, it's dilated, so that as I'm running or fighting, I can get more air in my body, okay? And then similarly with rest and digest, you know, I'm not really doing too much, my bronchioles can constrict back to normal, but you want to keep this in mind. And when we talk about things like albuterol, what is it? It is a bronchodilator, because it dilates the bronchus, opening up the airway to make you breathe. All the things that those cats were huffing on was albuterol. Okay?
How do you spell albuterol?
ALBUTEROL. It's in your textbook, because we do use it on animals.
Spell
And then the alveoli, again, the little sacs. These little sacs also contain a tiny little chemical, or maybe not chemical is the right word, just liquid, that's called surfactant. And surfactant helps to keep these little grape-like sacs, and we're talking microscopic, guys. It keeps these little sacs popped open, okay? So surfactant is a good thing. You wouldn't like to think that liquid inside your lungs is good at all, but this liquid, again, helps to keep our alveoli nice and popped open. So again, external respiration takes place here in the alveoli, where the gas exchange of CO2 and oxygen occurs. Yes?
So this is kind of going back to like the cats, but are cats' upper airways more sensitive than dogs because they're always getting the infections? Well, dogs.
I wouldn't say their systems are more sensitive. What I would say is the viruses that affect them are more prevalent. So the lungs, they're kind of gross looking. These are actually really cute because they're like mouse lungs. They're huge.
It looks like a fortune cookie.
They do. They kind of do. So again, with the base and the apex, so remember your apex is your point, the base is the fattest part. So your base is what sits at your diaphragm. Okay, and then again, the heart lies between. Kind of cute. Lungs are divided into different lobes. For example, this is not just one lobe, or excuse me, one lung and one lung. This is actually 3 different lobes, and you can kind of see the division here. This one actually might be 4. 1, 2, 3, and 4. But they're not just one big sac. They're actually divided into chunks. And you can do, if you have cancer or some other pathology of the lungs, you can do a lung lobectomy where you just remove one lobe of the lung and leave the others there.
Does that make it harder to breathe?
Not generally, and again, if it's a disease process, removing the disease portion generally improves the condition. Not terribly common, but there are cases where that happens, for sure. I'm not going to ask you this as far as lung lobes, but it is just good to point out their names by position. So cranial, caudal, accessory, what have you. Again, we don't really care too terribly much about this, but just knowing again that they're not one lung and one lung, that they're actually made up of different lobes. Okay. The hilus is something that's important for you to know. The hilus we will have on lots of different structures going forward in the body. The hilus is the indented area, and this is also where we have our structures entering and leaving. So this isn't easy to see. I mean, you can kind of see it's a little bit indented, right, kind of along this way. So this would be the hilus. And again, our connecting point to all the structures that enter and leave the lung would be right here. We have the bifurcation and one bronchial branch heading into that lobe.
Why is there 4 on the right?
I don't know. No idea. No clue. Yeah, ask God is what I would say. I ask God a lot.
Your heart takes up some of the room.
Yeah, probably makes sense. Good one. So pulmonary circulation. So when we get the air all the way down into the tiny little grape-like sacs, and I love this picture, you can kind of see the alveolar sac. Again, we're going to have our air within these. But the alveolar sac are surrounded by the capillary bed or the capillary network. And again, how thick are those? 1 cell thick. So they really are like a mesh, like a pantyhose, if you want to think of it. Very, very thin. And this, again, is where our gas exchange is going to take place. So it's within the capillaries that surround the alveolar sacs where that gas exchange happens. Again, this we know pretty much. So the thoracic cavity and all that's within it. So your heart, your lungs, the trachea.
Or the capillaries only in the lung?
No, capillaries are all over your whole body. We said Tuesday, 40,000 miles. Capillaries. Okay, I think we know this one. Mediastinum, we went over a little bit earlier in the week too. So the area between the lungs, the biggest structure, of course, living there is the heart. But we do want to add, if you had to really be specific, all of the other structures that are in there. Okay, so that does include the trachea, the esophagus, anything that runs between the two lungs. And then the diaphragm, we've talked about him a little bit before. Yeah, I did spell him right, sweet. So he is considered skeletal muscle, but do I control him? Not really, not really. Can I control him? Yes, right? I can take a deeper breath than what I normally breathe, right? But sooner or later, the system's gonna take over, right? So it really is not a voluntary muscle the way we think of other skeletal muscles being. Now the diaphragm does help with respiration and allowing our chest to expand as we inhale and get smaller as we exhale. So it is dome-shaped when it's relaxed. Again, we said yesterday, and even going back to the picture just a slide earlier, the ribs come all the way down here. Where do my lungs end? Like right here, like right here. My diaphragm really hides or lies right behind my xiphoid. So in terms of lung action, again, all of this area. Okay, again, it's not all the way down to the bottom of my ribs. That would be nuts. I wouldn't have enough room for my liver. But it is dome shaped, so it kind of follows the rib cage in terms of shape when he is relaxed. When the muscle contracts and enlarges the space of the chest, it flattens out. So when he's like this, more when I'm just sitting here or after I just exhale. But when I take a breath, he flattens down a little bit to, again, allow my chest to really expand and get full of air. And diaphragm's pretty important.
Is it on top of the ribs or below it?
Picture doesn't really help you, but it is a border between. So it really isn't necessarily on the ribs. I don't know. The ribs you think of as your side wall. The diaphragm is just between the walls. If that helps. Yeah, that picture didn't help much. All right, so this is where we get into a little bit of what we talked about yesterday with the heart and how it pumps and the pressure that builds up. Part of that with blood pumping comes from the respiratory system's pressure that it has. So there's a partial pressure vacuum that exists within our chest. And this helps to keep our lungs expanded out to our chest wall. So this pressure, again, helps kind of blow up or vacuum our chest. And that pressure, again, is going to help with getting the blood back to our heart. Again, veins have valves that keep it from going backwards, but what's pushing it forwards to get back to the heart? It's the pressure in the chest that helps with that. Okay, so very important. Again, the diaphragm and other muscles are going to help with inhale and exhale and reducing the size or increasing the size of our chest depending on if we're breathing in or breathing out. Okay, so our negative pressure. So inhalation, I think you guys maybe remember this because we talked about it back with muscles, right? So obviously inhale, bringing air in, your main muscles, and bringing air in are your diaphragm and your external intercostal. Remember the little gnomes pulling my chest from the outside, my external intercostals, as well as my diaphragm help to get my breath in my body. How do we know that? And you already knew it from muscles, right? And same with exhale, so sending the air on out, reducing the size of your chest. Again, internal intercostals are helping to push the air out, and then your abdominal muscles as well with this. Okay, make sure you know those too. What muscles help with inhale? Which ones help with exhale? I think the size of the chest, do you feel like that's easy? When you breathe in, your chest gets bigger. When you breathe out, very good. And then we have a couple different terms that we use mostly in anesthesia. Mostly this is in anesthesia when we are monitoring this type of specifics related to breathing. So our tidal volume, our minute volume, and our residual volume are all different ways that we can monitor certain amounts of air being breathed in a certain time frame, how much air is left in the body after you exhale, because you don't exhale everything. But there are ways to double check this, and it is, again, more important with animals who are anesthetized than it is for a physical exam. Okay, we have other ways to check respiration there. So how does gas exchange work? One word. Good guess. It's a scientific word. Okay, go further with that. Concentration gradient, and how do things move across the concentration gradient with diffusion? Very good. So how does gas exchange happen? Diffusion. It's simple. Area of high concentration goes into the area of low concentration. The area of low concentration moves into an area of high concentration until we're balanced out, right? So again, when we think of breathing in and out, Guys, there's no way for me to breathe everything out of me. That's just not possible. Okay, so there's always going to be a little bit of air left in, and that kind of helps with this balance of the oxygen and the CO2. Okay, so really these handful of pictures that we have here just kind of show this. So again, high oxygen diffuses into the area where the blood has a lower concentration of oxygen. It's going to balance itself out. The high level of CO2 diffuses into the blood where the level is lower. Good Lord. So it really is just a simple exchange. Okay? Again, for one of the most important processes of our body, how it happens is one of the more relatively simple processes. It's just a balancing act. Okay. Yeah, this gets a little weird. This is, again, more important when you guys get to surgery and anesthesia your last semester and you're learning about all the different types of gas. You do have to learn about all the ones that we don't use. I'm sorry. But this is definitely going to come into play with that. You've probably seen this Dalton quote before from like 8th grade chemistry or whenever we took chemistry. In high school, the total pressure of a mixture of gases is the sum of the pressures of each individual gas. And for us, this is a rule that we'll use when we are, again, anesthetizing animals using both oxygen and our anesthetic gas. So it says the pressure of each individual gas is considered the partial pressure. Partial pressures of O2 and CO2 in blood and the capillaries can be determined by partial pressures of CO2 and oxygen in alveolar air. So what that tells us is, again, we can measure what the patient is breathing in and out and kind of get an idea of how much gas exchange is taking place on a cellular level. And that's nice to do, especially in cases where these animals are really compromised and they're not breathing very well, or we're having to help them breathe. We can determine hopefully a little bit more what's going on and why, how to help them. Yeah.
Isn't that like common sense that if you add them all up, it'd be the total? Or is it like stating that with other chemicals when they combine, they lose?
Well, I bet it was common sense to Dalton who wrote it. But I think as they were starting to discover all these new elements and new gases, that this came into play with that. How does it apply to us? Again, being able to monitor different parts of our patient's respiratory system while they're under anesthesia. And that'll come into play with like your capnography, how high you're setting your vaporizer on your machine, whether or not your patient is breathing, the basics. So what controls how we breathe? Again, I can control my breathing, right? I can do my meditation or whatever, hold my breath when I have hiccups, all of that kind of stuff. But sooner or later, your body's gonna smack your conscious self and be like, let me take over, right? Let me just take over. So we do have our brain and brain stem that controls our breathing. We consider our brain stem to be, our oldest part of the brain and controls a lot of our really important yet basic functions in life. So both the brainstem and the medulla oblongata, fun little guy you've heard about before. So these centers, again, help us by determining lots of different factors in our body, and if we need to increase or decrease our breathing. Again, you can control it. You can hold your breath underwater. Not for too long. Some people. So we also have mechanical receptors. So we have receptors that can tell us if we need to, again, increase our breathing or decrease our breathing based on how much inflation and deflation we feel, okay? So it tells us nerve impulses can be sent to the respiratory center in the brain when lungs inflate to a certain point, and that's going to trigger us to exhale a little or sigh, right? Muscle contractions produce inspiration or stops. We're going to breathe out a little bit. Again, another set of impulses is going to be sent to the, when the lungs have deflated to a certain point. And then I'm going to breathe in. Again, this is happening without conscious control. How many times a day? Millions. right? Millions. So this whole process, again, of the brain system keeping track on one hand, then we have actual mechanical receptors in the lungs themselves, right? Do you guys remember back to the bladder when we were talking about stretch receptors of the smooth muscle? So again, I can hold my bladder and not pee my pants, but it's gonna get to a certain point. It's kind of the same with this. Again, the body is in control, not our conscious mind. Yes.
So when people hold their breath, is the length of time something to do with the structure, or is it like?
I don't know. That's a good question. Google it. Other things that we obviously keep track of are the chemicals themselves. How much CO2 is in me? And do I need to breathe it out better, deeper, faster, longer? Right? So our chemical receptors, again, help to maintain that homeostasis, keeping our blood pH perfectly regulated within that nice 7.35 to 7.45 zone. We have different monitors all over the body. So our carotid arteries, obviously our brain stem, he's in charge. The aorta too, though, can tell how much oxygen is in the blood he's pumping, right? That's pretty neat, pretty cool. So obviously, again, what are we monitoring? CO2, oxygen, and pH, which is a direct balance of CO2 and oxygen. Again, we've talked a little bit about this back with the whole bicarb thing, right? So when we have increased CO2 in the blood, it decreases our blood pH and we become what's called acidotic, or a condition of acidosis. This will trigger the body to breathe. Well, breathe more. So it's gonna tell the brain, hey, oh my God, you guys, we're suffocating over here, way too much CO2 in my body, trigger me to breathe more so I can get the CO2 out and get more fresh oxygen in, okay? Same thing when we have the decreased CO2, it increases our blood pH. And that's where we become a little bit alkaline. And again, the respiratory center is gonna get the message that, oh my gosh, things are going wrong, and it's gonna increase the depth and the rate of breathing. You know, I think sometimes we think that hyperventilation, like breathing really fast, is good. It's not, because you're not really getting a nice full breath of oxygenated air. And when you're hyperventilating, nor are you able to fully exhale that really big breath of CO2 out. So when we think about, you know, the way that our patients are breathing, it is important to recognize that the way they're breathing signifies a lot of what's going on inside their bodies. Again, we know that our job is so much harder because our patients don't talk to us, right? So we have to take these little clues from the body systems as we're doing physical exams. Okay, again, we can't ask, you've been breathing weird lately? Right? I mean, the owner can give a lot of historical background to some of this kind of stuff, but the way that a patient is breathing is important. It is important, and the more that you see that are normal, the easier it will be to really recognize an abnormal breathing pattern. Okay? All right, you guys, we're almost there, almost there. So hypoxia we've talked about before, so low oxygen. Hypoxemia, again, specifically low oxygen in the blood. We hope that this is not a long-term condition, because it will eventually kill you. So slight hypoxia, your brain's gonna get the signal to go ahead and increase your breathing, okay? So if we see an animal, again, with a higher than normal respiratory rate, he's not panting, but he's tachypnic. What does that mean is going on in his body? We need to think about that, right? Maybe he's got low oxygen. If it's very severe, again, we can have our nerves or neurons become so depressed that the impulses can't even get sent to the respiratory muscles anymore. And that's where the brain is firing, but the impulses don't get there. They never get the message to breathe. That's not good. That's where you see your patient and respiratory arrest. And the heart's right behind it. Okay. All right, you guys, we did it. Oh my gosh, we did it. Woohoo. I do have something else I want to share you guys as we have just a little bit of time. I'm going to keep you another 15 or so, and then I'll let you out for lunch a little early. Give me a minute to pull this up. I just kind of wanted to show you guys a little bit of a resource that we have in the hub as well to use for studying anatomy. And some of you guys might already have this, depending on where you got your textbooks. Oh yeah, we sure can, absolutely. Yeah, I'll pull that up first. Absolutely, you guys really did pretty well. There were some things that had me question. What's that?
Was the spelling awful?
The spelling was all over the place. I'm not tripping too hard, guys. Oh, that's wrong way. I'm not tripping too hard on that. Like I said, if it was clear that I knew what you were trying to spell, you got at least a half point. You know, we are still trying to be nice, but there will come a time where, again, you know, you're going to want to just keep getting better. That's all we can ask, is just keep getting better. Okay, let me pull that up. So how did you guys feel on the anatomy exam? Not too overwhelmed with the fill in the blanks? I mean, you already had a fill in the blank by that time, right? I think for some of you guys, it was the really super basic questions that hung you up the most. And again, I say that with love. For example, bones, long bones specifically, are generally made of what two types of material? That cancellous and compact threw a lot of people off. Was it just too basic of a question? Just kind of rando? Yeah. And it is like coming up with those words. And that's where, again, you know, anytime you can practice your recall helps, hopefully helps. Okay, I'm getting there, guys. I'm getting there. I wanted to pull up a good example. I know some of you guys are like, well, some of you guys have maybe expressed to me that you're really upset with your scores. Here's the thing. I don't expect any A+, not by the majority at all. That's not what this is about. There's no way to have perfect scores with something you just learned about, with something you only have a month under your belt about, right? So I would encourage you to get off that horse quickly, okay? And if you need some slap action, I got it. If you got a B, awesome. If you got a low C, awesome. If you got a D, it's okay. It's not the end of the world, okay? It's not the end of the world.
70% on everything.
I'm sorry?
I thought we were supposed to have 70%.
You are, but I can't kick you out. If I had my way, I would kick people out of the program if they didn't maintain a 70%. How long do you think I'd have this program?
2 months.
Okay, so here's the thing. When I was in vet tech school, that's what happened. If you didn't have a 70, you didn't come back to class. I wish I could, because that would, again, impress upon you the importance of this. Not that we haven't already. But if I had my way, that's exactly what would happen. We give you a chance to make it up with a makeup exam, right? So if you did really poorly, either in anatomy or in another class or across the board, you can still fix it, but what's it gonna take? More work than what you've obviously done for the first exam, okay? So if you're not happy with the score you got on your first exam, you need to change something. Okay, your study habits, the amount of time you're dedicating, how you're studying, something's got to change if you want to see improvement. Again, guys, do not expect to have perfect scores across the board. Okay, that's just not realistic, not in a medical program. Okay. Any questions on that? Okay, so makeup exam is usually towards the end of the semester, usually between week 14 and 16. Okay, you guys will be told what to expect on your makeup exam, but here's the thing. If you didn't do great on this one, you have to do better on the next ones, and you have to do better on the next one after that, and you have to do pretty dang good on your midterm. Okay, I'm not trying to pressure, but I'm just being realistic. It's not possible for somebody who has a 50 at week 4's exam to come back. Okay, you're gonna retake the class. Okay, and I try to be as transparent with that as possible. Again, it doesn't mean anything, right? That's why we have the repeats available, is for you guys to come back and maybe get a second round if need be. But that's, again, you have to be the one that makes the change, right? Or utilize the hub, or start a study group. Have any of you guys had a study group so far? Beyond what you've done in class? Okay, that doesn't count to me. I mean, though it's awesome and Emily does a fantastic job, it doesn't count to me. Because your brain is still in school mode while you're on campus here. Okay, so I would maybe try doing that. You know, talk to each other, see what dates are gonna work. If nothing else, and you're just talking about, oh my God, Mrs. H's way to talk about this is so silly, isn't she silly? Getting together and at least just shooting the shit together,
Yes, but.
right? It does help, it does help. Okay, yes, Dom.
Can we go back into the test to see that?
You can. I have not caught yours graded yet. My God, I'm gonna do that ASAP. But yes, you can.
Okay.
You can.
I looked at it, I was like,
So yeah, the other one that kind of, and guys, you know, I don't know how to go through this. Sometimes, you know, I feel like I don't want to hurt feelings, but the other really easy question that I thought that a lot of people got wrong were the 3 functions of muscles. And I've said from the beginning, you have to know your functions of every body system, right? So like cram, cram, cram. But the one for the muscular system was stupid easy. It was motion, posture, heat. I got all sorts of answers. And that's okay. You guys were at least giving me something. But try not to overthink it either. Motion, posture, heat. Motion, posture, heat. Okay. If you put movement, you got a point, right? Because that's the same as motion. So don't be hung up on those specific words, but just don't overthink it either. Okay. Functions of abdominal muscles, I think everybody got that. Sebaceous glands, I feel like everybody got. Okay, layers of skin. I could have asked the layers of the epidermis, but I didn't, because I was trying to be nice. What are the 3 layers of skin? So a lot of people got dermis and epidermis, but couldn't remember the stupid low one. And that's okay. I mean, it is what it is. You guys are getting 2 out of 3, but use those as a way to jog your memory, or to at least jog your medical terminology memory into what words mean low. Hypo, so hypodermis. Boom. Right?
in the textbook, it was said both ways, whether it was labeled as subcutaneous.
I took subcutaneous, but I got random things like endodermis. Again, I love that you were trying to use your medical terminology, because endo is inside, and that sort of kind of made sense. I can't give you a full point for it, but I could see where you were going, right? Okay, I feel like I'm making this worse. I feel like now you guys are super depressed now. Otherwise, I feel like you guys are pretty good. The muscles, the muscle names, you know, we just got to practice spelling. That's all. I know. I think everybody got the Volkmann canal question, the yellow bone marrow question, I feel like you got. I had some people even put Steve Merkel, or Steve Urkel Merkel. I was like, yes, because that will never leave your memory now, right? That's my hope. Functions of the skin, I think everybody got for the most part, like vitamin D and cover and protect and all of that jazz. What say you guys?
What?
You have anything else to say about this?
No.
Okay, I'm done then too. Guys, the thing with exams is, well, and I'll be the first one to tell you, I do not know everything. And I'm actually pretty okay with that.
pretty rock solid with it, in fact, because I know that I can lead myself to the answer, or I know where to look it up, right? And that's where you guys, again, don't beat yourselves up for not knowing everything. That's impossible, first of all. Look how much instead you've learned in the last month, right? I think a lot of our confidence in life comes from how we talk to ourselves, okay? I have been in your seat as a vet tech student. Fuck this, fuck her, it's too fucking hard. Thank you, Teresa, I'm so sorry. I have been there though, okay? I've been there taking the test.
Very well.
All right. So I have been there. I totally understand how hard it is. I would make my little statement again. I know it sounds crazy. You guys probably think it's nuts to even think about going and trying to get a job in clinic when you're learning this stuff. It helps though, a ton. Okay, so if you're finding that this stuff just isn't sticking or something, go try to get a job in a clinic, even if it's just as a kennel assistant, right? Oakcrest, West Side, part-time kennels. Forgot to post it. Somebody messaged me. Oakcrest. Getting into a clinic would help a ton. But yeah, I mean, you guys cannot beat yourselves up for not knowing everything. You've still got 1.5 years in this, okay? So it's gonna be a long ride out. If you're already beating yourself up this hard the first month, it's not gonna end well mentally. Okay, I know, because I have been there. Okay, you have to say, I got a C-, fuck it, I'm good. Let's move on with it. Okay, yes, I'm gonna study a little more, read a little extra, highlight a little bit extra, and not be at that point again, but I'm not gonna sit there and fucking wallow either. Okay, that's a waste of your time. And I have had a couple of you guys come to me and say, I don't know if I can do this, and I feel like slapping you. You don't know yet if you can. Okay, you've only had one exam. Let's talk after second exam. Okay, and if we're seeing a trend with bad exam taking, we can talk about that. But the first exam's kind of like a freebie in that way that we let you make it up. Well, one exam, doesn't necessarily mean it's exam one. But that's where, again, it's don't be so hard on yourselves. Okay, look at how much you have learned, a ton. And look at all you've gotten right. Again, some of you guys are like, I missed 8. God, why are you not saying, I got 12 right? It's how you talk to yourself, okay? If you're negative Nancy to yourself, okay? So instead, I got 12 right that I wasn't even sure of. Right? Okay? And that's fine. Take it, pat yourself on the back, and move on. Move on. Okay? All right.
Anything else on the exam? I just want to show you something super quick. Okay. Sweet. All right, let me pull this up here. This is something that I was telling Chris and Caitlin about using maybe in anatomies on Wednesdays because I'm getting some hit and miss feedback from you guys on some of those activities.
The idea with going to the hub with them is to not have me lecture at you 3 days in a row, if that's what you want.
Coloring sheets.
Okay,
are
I
not
feel like it's a great.
No.
Especially when they don't explain it. We're kind of
Yeah, they don't really talk to us.
Coloring, no, coloring sheets. are
Okay,
not.
so what we might try to do instead is a little bit of anatomy that's specific to Whitney prep. Okay, so it might sound crazy to start studying for the Whitney now, but it's not. It's not at all. So yes, we did. We did a lot. So anytime we do have any extra time, we don't usually in anatomy because we're like bang to the wall, right? If we do have extra time in anatomy, I will generally pull this up and just say, let's play around a little bit, right? So this is a program that is from the company that produces this book, the Review Question and Answers for Vet Techs.
Oh, is this the CD?
This is not the CD. This is the online version.
What's
of
on the
it.
CD that comes with it?
I don't know. Maybe something like this. I do prefer the 4th edition to the 5th. The 5th has a lot of errors. This one has a handful, but not as many as I noticed with the 5th edition. This is a book that I would recommend you guys get. Whether or not you purchase the online availability is up to you. Somebody in cohort 4 did just double check and it was like $120 for the book plus this. But you have this. Caitlin graduated 3 years ago. She still has access to her book. It's a pretty damn good deal. And of course, she didn't even need it to study because she knew she was going to pass first thing. But you guys, as you're getting started, again, it might sound crazy to start studying for the Whitney, but as y'all are studying for Barnco,
Okay,
why not study the same?
quick Google. It's on Abe for $7.30. $7.30.
Okay, whether or not that lets you log into this though. Okay, so it says Elsevier login?
Yep.
Okay, great deal. So this is
Where is it?
Abe. Google. Dude, Google's your friend.
Right. Google everything.
Yeah, check it out. I love this, and I use this for the Whitney prep class that we do with cohort 4. We do worksheets and we go through this. So do you guys want to do anatomy and physiology or med term? Okay, let's do it.
We'll come back and we'll do some med term another day. So this just gives you a feel. So some of the stuff we haven't covered yet. It just gives you a feel for the type of questions they're going to ask. Decreased osmotic pressure in blood would cause.
Decrease osmotic pressure. So I think we had this question on like a homework thing. C.
All the above.
See when you don't know. No. That's okay. So some of this we haven't covered. Again, it just gives us a feel. Oh, you know this one though. Shirley. Oh no, this is different than what I was thinking.
Oxygen respiration. No,
that's
without oxygen.
I'm not doing so good.
You haven't learned this yet. Cattle don't have any upper teeth. They can't really bite you. Okay, see, and I'm wrong half the time too. The dorsal plane, oh my God, we know this one. Oh, dang it, upper and lower. No, that's wrong. That is totally wrong.
The dorsal plane divides the body into dorsal ventral portions. Yes. Merce, you were right.
Again, this has a handful of errors. The other one was almost, I mean, every question I felt like was wrong.
It depends on how you're looking at the body though, because the upper and lower parts are the back and the belly.
Yeah.
Front and back, I would say.
Well, like
Right.
you said, you were the
Yeah.
I would say front and
Yeah,
back.
cranial caudal. You're right. You're
Yeah.
right. Yeah, it's okay.
It's
It's okay.
something.
It could have been worded better. I agree.
I feel like that's half the problem.
Exactly. But I think that's what they said is it was more like this.
What is the value of the X in this calf's dentition chart?
2.
Shoulders.
I don't know that they have 4. Maybe they have 4. Oh,
Oh.
okay. There you go. So you'll learn all of your dental formulas for everybody. Obviously, I don't know cows.
Do cows have wolf teeth?
No, but they're considered a premolar. That far up is when you
Right.
start your premolars.
Because horses have the wolf teeth in between their gap.
Mm-hmm. Yep.
Cow teeth hurt though sometimes.
The amount of
It's like more
energy
of
an
a
animal would
pinch,
acquire
I'm
from
sure.
burning off, I don't know. No idea. Okay, there you go. We will calculate, not next week, but the week after, because next week we'll do GI, like anatomy, and then week 7 is nutrition. And that's when we will actually calculate our kcals for your pet food. So I'll have you guys go home, take a picture of your pet food, either dog or cat, I don't care. And then you bring it back to class and we calculate how much that animal actually needs based on kcals versus what the bag says to feed. The bag always says higher, always. If you're feeding the amount of food that the bag of dog food says you're feeding too much. And this is standard. This is why, again, 80% of our pets are obese. Because we were feeding them what the label says. Why does the label say higher than they need?
There's so many need exercise.
So you keep coming back and buying the bag of dog food. So the kilocalories we will actually calculate. I would have no idea how to calculate burning of the tissue, but we'll figure it on how much they actually need to eat. Okay, the structure by which venous blood from the intestines bypasses the liver.
D sounds good. D sounds good.
But he goes outside of. I feel like it's portal cable.
Exhaustion.
I don't know. Let's see. Yeah. So this is when you have the little Yorkie pups that come in icteric.
We just
Yorkie?
no. 14.
Yeah. Dang. That's sad. Yeah.
The family bonded with it, and then
Yeah. That's hard. That's hard. A pulse taken from the inguinal area of a dog would be from the. Oh my God! You guys are so smart. Geniuses. Geniuses. See, we know stuff. We know stuff. What's the term used below the carpus for the surface directed caudally or ventrally? Yeah, I had to just put my hand up. Very good. So again, see how you have to visualize these questions? It just helps to visualize as you are going through. Sympathetic stimulation of the heart increases strength of contractions by? Okay, so here's the thing, guys. I'm going to tell you right now. Exactly. So here's the thing. Have we talked about the rightest of the right yet?
The what?
Okay. So there is what's called the rightest of the right answers. And the way the Whitney is, and this is actually a benefit to you guys. So let's say this picking D, you get 100% of the point for this question. But if you were to pick B, you would get maybe 75% of the points of that question. But this is the rightest of the right. This isn't wrong necessarily, but this one's better. And they do. So here's the thing. Again, with not freaking out when you don't know a question, lead yourself to something, anything you can find that's going to lead you to something, right? To hopefully get to the answer. So if that helps make you feel a little bit better about the Whitney, I remember when I learned that, I was like, oh, hell yeah. But then I was like, oh, God, now I'm going to, be rightest of the right. What's the rightest of the right? But you guys will even go through some of our exams in some of the classes and be like, well, that's not right. Technically, it's the rightest. My other students, they hate me right now because I say that all the time because we're going through Whitney prep like this and doing worksheets every week. And okay, here's an example, and you'll appreciate this. So the question is, how many air sacs are in a bird? And the answers are 8.
Depends on if you're trying to pair.
2 pairs of 4, 10, and 12. They would pick 2 pairs of 4. Well, that's not right. 9 is the answer. 9 is the answer. What's the number that's closest to 9? But picking the 2 pairs of 4 gets us up to 8. So they'd still get some points for that question. I know. Why do they do this to you? They're judging your critical thinking skills. They're not judging black and white because, guys, medicine can't be that way, right? They're judging your critical reasoning skills. Yeah. No, you do get a little bit of points. And this is a great example. So one thing has to happen before the essay node can get faster, right?
So is that when we have the critical thinking of the essay test?
Wrong one. Oh my God, really? No, they don't. No, they don't. Because under your olfactory, which is cranial nerve number 1, it's like right here. It's like right here. That is nowhere close to my brainstem. Bastards. Oh my God!
Hey! All right.
Right. Atrium. Left. No, it's good.
All right, one more. Oh. So it's the question that I'm like, you don't need to know this. So the glottis is a hole. The glottis is not anything, it's the hole. Yeah. So those are all structures. The glottis is just the hole. I know, trick question. But again, you've seen those. You saw them just 20 minutes ago in lecture when I said they're not important. But you've at least seen them, right? We haven't gotten as far to, talking about the glottis. Really, the glottis is a structure we talk about a lot more in reptiles and birds because they don't have the epiglottis. So we just talk about the glottis. But it's just a hole. So it can't be something. It's like the pupil. The pupil's in the thing. Okay, one more. One more. Oh.
The palate would be.
Yeah, so oftentimes, and this is something that's really common, sadly, is the little cleft palates, puppies, but oftentimes when they are nursing, you see milk coming out of their nose and like little milk bubbles. You can tube feed them to an age where they can have surgery. A lot of times they get euthanized. Yeah. So it's just one of those things that if you're able to, tube feeding these babies though is tricky. It can, they can, and it's hard. So a lot of times they will just euthanize these babes. I mean, I'm sorry.
I'm sorry.
Don't get mad at me.
cannot save everything. I'm telling you right now.
No, and that's, I
Get
mean,
off that high horse, I'm sorry.
that is something, it's hard. It's hard to say, what we do with some of these. No, that's okay. I think we're good. Oh, dang it. Yeah, it's fine. It's fine, guys. So we're going to try to do a little bit more of this, and if you like this, and if we can do it in a way that's helpful in Wednesday labs or Wednesday free time, fun time, you guys can take a notebook with you, start jotting some of these things down as you're going through them. But that's fine with me if you like it, if you guys think it would be helpful. Again, it's okay if we don't know the answer, but it's giving us exposure to what the exam's going to kind of be like. Okay?
So a lot of the questions on the Whitney are a lot of them just like stuff that will go over your head that are common sense.
No. Guys, I will tell you, I was not 100% prepared when I walked in to take my Vicky. I was not sure. I said, you know what? I'm going to do my best. That's all I can do. I'm not going to beat myself up over this, right? What I did, though, was I kept track of opposite sides. You do get scratch paper. And every time there was a question, I was like, oh, no idea. I would do a scratch mark. And I would pick the best answer I could, right, using my critical reasoning or whatever, but I would hash mark it so that at the end of the test I could look over and see, oh shoot, that's like 20 that I didn't really feel that good about. Kind of gives me a feeling for how I was doing. There were a lot of questions on mine that I did not feel prepared to answer in terms of content, like llama gestation or elephant venipuncture sites. I mean, I'm not kidding. It will have some random stuff that we will never cover in school. We won't.
That makes sense.
Yeah, elephant over ears.
What's the point? I know. I'm sorry.
Did you pass your first time?
I did. I did pass first time, one and done, and that's what I expect out of you guys.
Did it give you like a grade?
It does give you a grade. It does. So you get a score. It's something very similar to how we do our HESI scores in the prep. So I don't even know what mine was, but it does give you a number like 680. And then you go back onto ASVIB, the website, and it'll tell you like 500 to 600 is like a C, 600 to 750 is a B, and anything over 750 would have been an A+. So you kind of sort of get a grade. Honest to God, don't give two shits as long as you pass.
Pass/fail.
Don't care. As long as you pass, doesn't matter what the score was, right? You just take that pass to the bank. But again, does it have to be over 70? Yes, it does.
How close to 70 was I don't know. I don't even remember what my score was, and now I've been kicked out because it's been so long. But across the board with a lot of our students, we have most of our students, again, first year we had 75% pass rate, second group we had 68%. This third group that takes theirs in about 3 weeks, I expect 100%. They're that good. They're that good. But a majority of the students are scoring way above and beyond passing. I've had a couple who barely. Do I give crap? No, because they passed.
So like, how does it work? Like once we're like all done, like do we schedule ours or do you schedule it?
You schedule it. I pay for it.
So it won't be like all of us going at once.
Technically, you paid for it with your tuition.